Hi, my name is Leslie Ketch. I'm an associate professor of early childhood education at National Louis University. My background and research interest is in infants and toddlers, and especially supporting parents during those early months and years of infancy and toddlerhood. So today I'm just going to talk a little bit about how we can work to support our youngest children during times of stress, trauma, and isolation like many of us are facing right now. Um, so what I'd like to do is introduce 5 ways that we can support young children during these times, and as you as caregivers can also be there to support children. So 1, establish routines. Routines are critical for young children to feel safe. Knowing what to expect in their day-to-day life really establishes a sense of trust and reduces stress for children. Adults and caregivers might find the concept of doing the same thing every day boring, but for children who often have really little say in what their daily activities are, having this routine really builds a sense of confidence in their environment. So as much as possible, keeping regular sleep and meal times is really helpful. Setting a daily schedule, which includes some time for play, but also sets expectations for caregivers to attend to the work that they need to do. The schedule does not have to be detailed, it does not have to be specific, but having that general outline can help you keep yourself with that schedule and also give children a sense of the same thing happening each day. 2, avoid the news but keep talking. It's necessary for us to keep tabs on what's happening during these times, but it's not for children. Caregivers need to control the information that's being presented in front of children. Even young children who are nonverbal still have the ability to understand much of what they hear and see on the news, even if they cannot verbalize it themselves. They're very good at picking up on stress in voices and seeing stressful images. So while it's difficult to even turn on the TV or the radio without that constant stream of information, it's really helpful to turn it off. It's also important, however, to acknowledge the feelings that children might be having and to allow them to express those fears and anxieties. For very young children who might be nonverbal, it's helpful if you can help them express their feelings with saying things like talking for them. It must be really hard not to see your friends at childcare every day, or I'm sure you really miss Miss Lucy. And these are confusing times. It really feels very powerful for a young child to verbalize the things they might be thinking but cannot express themselves. Number 3, keep calm and take care of yourself. Even when children are unaware of these outside events, if we can shield them as much as possible, they're very perceptive at recognizing stress and anxiety in their caregivers. When so much feels unknown and unsure, it can be very hard to shield children from these feelings. So it can be helpful to set aside a time during the day when children are napping or at bedtime to talk to other caregivers and adults about your stress and feelings of concern. Number 4, play is still the best form of learning for young children. Trust in this and trust in your child's ability to use play as a form of learning and also as a way to work out some of their underlying fears and anxieties. They learn an incredible amount from having that unrestrained time to play and use their imagination. 5, set realistic expectations for yourself and your child. You will not get all the work done the way that you want it to be done. It won't be done at the right time when it's supposed to be done. And it's okay to set aside that time to relax and have fun with your child. You are not going to finish all the e-learning tasks that are coming home from school, and that is okay. You are not going to be able to attend to every task that's coming from work the way that you used to, and that is also okay. We need to be kind to ourselves, and we need to be kind to our families during these stressful times and help support our children as best we can.